Rewire your brain. Whether you are simply anxious and overwhelmed, or if you have a diagnosis of generalized anxiety disorder, what you need to know about how to change your brain from anxiety is provided below. Under typical conditions, anxiety is actually merely a nervous system state. You need anxiety to keep yourself safe and ensure your survival. But regrettably, when you're anxious, your body might actually become immobilized. Your brain can trick you into thinking you're in danger even when you're completely safe, and there are several reasons why this can happen. Accidents and injuries, operations, physical discomfort, ongoing stress, mental trauma, not getting your needs fulfilled, and even trauma can cause it. The truth is that most of us struggle to identify the precise reason for our persistent worry, but we don't actually need to, because neuroplasticity allows us to rewire our brains to become less anxious. I'm going to demonstrate 3 vagus nerve exercises in this video that you may apply at any moment to rewire your brain to become less anxious. I'm Alpha Health Tech, and I can help you rewire your brain for better success, happiness, and health. If you're a new visitor, to get notified whenever I upload a new video, make sure to click the subscribe button and sound the bell. You may find links to everything I said in this video in the description box below. Let's get started. Okay. In order to rewire your brain and lessen worry, I'm going to teach you a few exercises. But before we do that, allow me to take a moment to discuss what anxiety actually is and what it is. Most people I speak with think that their worry is a result of their thoughts. Additionally, the majority of treatments for anxiety relief center on altering your ideas in order to lessen symptoms. The problem is this. Despite what the majority of us have been taught, feelings such as anxiety are not thoughts. In reality, emotions are the subjective interpretations of sensory information that your body sends to your brain. Interception is the term used for this. The important thing to remember is that thoughts do not directly generate feelings. Instead, interference tells your brain when you are safe and when you are not. Your body's internal condition changes as a result, which alters the sensory information delivered to your brain, which alters your emotional state. However, some aspects of your biology are so old that they predate the development of human language and are resistant to thought-based treatments. This explains why worry frequently recurs despite the use of affirmations, mindfulness training, or other brain-based self-help techniques. The fact that these treatments can only touch a small portion of your biology is the reason they don't function at all. In a moment, I'll tell you what to do about that. However, let's first discuss how anxiousness feels. Most of the time, when doctors talk about anxiety symptoms, they concentrate on what's happening in your head. They mention symptoms like hypervigilance, difficulty focusing, possibly racing thoughts, or a sense of impending doom. However, anxiety also results in physical problems. In fact, this is how all emotions work. You can tell what emotion you're experiencing based on how your body feels. A tightening in your chest is a common physical manifestation of anxiety. Anxiety symptoms can include a racing heart, difficulty breathing deeply, perspiration, trembling, stiffness in your feet or lower thighs, tight hips, or even clenched teeth. However, I've noticed in my clients that they frequently lean back to their heels as if they were pulling away from something, and many people lift their toes off the ground and clench their lower leg muscles as if they were stopping themselves from fleeing a real or imagined threat. People who are worried frequently display tightness around their eyes, a forward-leaning posture with their neck muscles, and clenched hands. We frequently fail to detect symptoms that are chronic and ingrained in our bodies. They just become the way we move through the environment and our default stance. Before attempting to move in a way that our bodies prohibit, we are unaware that we are tight. Even then, we rarely link persistent and habitual emotional states like anxiety to physical stiffness and poor mobility. Instead, we stretch more, seek massages, and when our muscles won't relax, we quit up after putting in a lot of physical effort and just believe we're getting older. It's untrue. Your nerve system and brain control how tight your muscles are. You'd be so limber under anesthesia that it would be simple to tuck your feet behind your head. To avoid dislocating a joint, medical professionals would have to move you with extreme caution. But when you awaken once more, the tension is back where it was. Now that you know, what do I do when I feel anxious? I'll elaborate on it. Now, we'll demonstrate 3 exercises for easing anxious symptoms. The expectation that we'll never have to confront challenges, threats, or hazards in life is just impractical, and anxiety is a typical component of your stress response. We don't want to be stuck there, and the method to avoid getting stuck in anxiety is by assisting your autonomic nervous system in becoming better at regulating. It lets you know when you're safe and when you're not so you can mobilize to defend yourself. Body-based exercises that relieve stress from your nervous system by communicating safety signals to your brain via the proprioceptive system are one approach to achieve this. Therefore, it is what we will do right now. Click. For example, if you're prepared to try some anxiety-relieving vagus nerve exercises. The book Accessing the Healing Power of the Vagus Nerve by Stanley Rosenberg, which is an excellent resource for learning more about polycule theory and anxiety, served as the inspiration for these activities. All you need to do is place your right hand atop your head and tilt your right ear towards your right shoulder while sitting comfortably, either on the floor or in a chair, depending on which is more comfortable for you. As a result, your body will be twisted to the right, and all you will need to do is simply move your gaze. Your head will therefore remain in this position, and your eyes will only go up and to the left. They will therefore move to the left of your field of vision, and we will just maintain this position for 30 seconds while you keep your head still. No need to exert yourself. If you catch yourself taking a sigh, swallow, or a breath that's a little deeper than the rest, let it out. And on the other side, we'll simply repeat the identical action. Take a brief break, if necessary. When you're ready, raise your left hand to the top of your head, tilt your left ear towards your left shoulder, bend your left elbow slightly to the side, and then lift your right eye up and to the right. And once more, we'll hold this for 30 seconds. This is assisting us in breaking up these ingrained tension patterns and allowing us to deactivate. Go ahead and release that when we're a little bit more composed and present. Now, you can hold that for longer if you don't notice a sigh or a swallow. The minimum is 30 seconds, but you may certainly go for a minute or even longer. In the following exercise, we'll perform a very similar action but go a little bit deeper. It was particularly concentrated on relieving any neck strain and relaxing all the neck muscles. It will be lowered inside your rib cage. So your vagus nerve actually travels down your neck, down your torso, and all the way down into your viscera. It is a cranial nerve. To help release the tightness in your rib cage, we'll perform a little amount of movement there. So you'll use your hand in a manner that is comparable. Right hand to the top of your head, then turn around and place your left hand on your side, right here on your rib cage. Then you're going to make that bend a little bit deeper as you lower your head so that your right ear is pointing towards your right shoulder. Your left hand will be used to pull your ribs apart while you bend through your rib cage. Your entire spine will bend into an AC shape as you should feel them closing beneath your hand. We'll simply do the same with our eyes after that. Don't strain yourself when you pull them up to the left and hold this position for 30 seconds. Overachievers don't serve any purpose. Make the movement smaller if this is painful for you, then release it. You could then realize that breathing is a little bit easier. Perhaps you're a little less anxious. You can use these activities to take a break if you need to if you experience any emotions, which will occasionally happen. Less is more in this case. My work basically centers around the idea of titration, which is a chemistry-related word. It is a tool that chemists use to combine two compounds when pouring them together in huge volumes. For example, you might pour together 1.5 cups of one substance and half a cup of another. They cannot combine. However, if you do it drop by drop by drop, they will begin to meld and mingle. The same is true for these activities. Your system may have trouble integrating high dosages. In contrast, tiny adjustments over time can contribute to larger, more lasting alterations. Therefore, if you feel the need to take a break, do so. It's completely okay if you felt that was sufficient. We'll do the other side if you're willing to go on. In order to create a nice C shape through your ribs, you'll bring your left hand up to the top of your head, bend your left ear towards your left shoulder, place your right hand on the left side of your rib cage, and then move your vision up and to the right, moving your eyes up to the right. Keep in mind that it's okay to make this a small movement, especially if you have had any rib injuries. If this needs to be a smaller movement because you've had heart surgery, abdominal surgery, any sort of trauma, physical trauma to your torso, and of course, any mental trauma, that's absolutely okay. Release that right away. Actually, I don't count the number of repetitions or the amount of time while I work out for myself. I hold off till I notice a change in my body. But having a predetermined amount of time when you first start out is fantastic. It may seem a little safer if you kind of know when you're beginning and when you're going to end, especially if it's unfamiliar. For this next exercise, you'll need to find a spot where you can lie face down comfortably, but if you prefer to wait until you feel a shift in your body, that is also acceptable. Therefore, a yoga mat is a terrific tool to utilize, or you can lie on a nice carpet if you have one. So, while lying on your stomach, pull your elbows beneath your shoulders, place your hands flat on the floor, and support your shoulder with your elbows. You're going to turn and glance over your shoulder while elevating your head with the help of these muscles on the side of your neck. We'll simply hold this one for another 30 seconds. The sternocleidomastoid, a thick muscle along the side of your neck that can become quite tense, will also be reset by doing this. Many migraine sufferers have a lot of tension in this muscle. Therefore, releasing them can be beneficial for migraines or tension headaches, and will only repeat the process on the opposite side. So, raise yourself up and place your elbows beneath your shoulders. Your head will be turned to the right. We'll elevate your head to look over your right shoulder, maintain that position for 30 seconds, and then release it. We appreciate you watching this video about brain rewiring for anxiety. Please hit the like button and let me know in the comments if you find these exercises useful. To get alerted, don't forget to subscribe and press the bell.